Thanks to God and thanks to the Madagascar Mission Network for this opportunity, and thanks to all you who have come to learn. What I'm going to share about today, we're going to share about is Mission in Madagascar, about how the PCUSA, Presbyterian Church USA, does mission in partnership all around the world, in this case specifically in Madagascar, with a focus on the work that Elizabeth and I are involved with. We are here in Orlando right now. We left in late March of 2000 when PCUSA headquarters called all mission co-workers back from the countries where they served. And while we long for the opportunity to return to Madagascar, we have been grateful for the opportunities to be here for major milestones for our children, particularly.
And parents.
And our son Robert has just finished a master's in counseling and art therapy at Adler University in Chicago and has just launched his career as a counselor. And our daughter Frances graduated last December from college and started teaching first grade right away, and then is now teaching fourth grade at public schools here in the Orlando area. Madagascar, of course, is a great big island off the southeastern coast of Africa. The eastern side of the island used to be covered in rainforest, and there's still some rainforest left. It's extremely biodiverse, some of the most richest forest in the world in terms of numbers of species, with the most iconic, of course, being the lemurs. This is the Indri. But there are lots of other amazing critters in those forests found only in Madagascar. The western side of the island has dry deciduous forest, and this is the baobab with some of Madagascar's most famous baobabs. There are 8 species in the world, and 6 species are found only naturally only in Madagascar. Western Madagascar also has lemurs, and mostly those are species found only in the west. Southern Madagascar, especially the very far south, is where they have what's called spiny forest, which is an amazing assortment of plants and trees found only in Madagascar. And there too are lemurs. And again, these are different kinds than found in most of the other parts of Madagascar, but there are plenty of other creatures there as. And this photo illustrates the challenges the country faces to find a good future for the people of Madagascar, especially the children, but also for the unique plants and animals. I haven't mentioned central Madagascar up to now, and that's mostly because there's not much native vegetation and plants or animals in central Madagascar. Most of the plants you see in this picture are non-native, having been introduced from outside the country.
Now, Madagascar has more than just plants and animals. There's also 28 million people, half of whom are under the age of 18. And, oh yeah, sorry. It goes from me to him. They live mainly in rural communities, no running water or electricity, similar to what you see here. The majority are subsistence farmers, so they work very hard producing crops, taking care of animals in an effort to make sure that they have enough to eat and a little bit left over. The Malagasy have a rich cultural heritage, an amazing capacity for joy, and a very strong sense of community. However, there are difficulties. Madagascar is one of the poorest countries in the world, and over 90% of the population lives on less than $2, which means families face really hard challenges. Will they have food to eat? Will they be able to send their children to school or pay for medical bills, even as little as $10? Madagascar does have cities spread all over the island, and these have both challenges and opportunities. It's a challenge. People sometimes think they can come to the city and it's going to give them everything they need, and they come and sometimes they can't find work. However, it also provides opportunities because there is opportunity for education, much more than you could get in the rural areas. And there are diverse jobs if you're qualified for them. COVID is a reality now in Madagascar, just as it is all over the world. The first cases of COVID came to Madagascar in March of 2020. The government reacted very quickly and closed the airports and had internal transportation restrictions. Meetings were stopped, so churches were closed, and they were able to keep their spike very low and controlled. Then in April of this year, as you can see on the screen, it spiked again, probably due in part to cases of the South African variant. However, the government reacted again with closing the borders, having internal transportation limited, and again, they closed down meetings and churches, but the spike went down very fast, and at this point, they have very low daily cases. They have the airport, international airport, is still closed in an effort to keep out the Delta variant.
Closed to incoming
Excuse me.
people.
Yeah. Yes. Internal travel's okay. They also have been able to get the first lot of vaccines. AstraZeneca came in May of this year. At the beginning, there were some rumors, but by the end, they were actually able to use 80% of the vaccines that they were given, vaccinating 190,000 people. The second doses of AstraZeneca have already been started this week, and reports are that people are coming for their second dose, which is very encouraging. Johnson & Johnson is also in the country. Doses, vaccines with Johnson & Johnson should be getting shortly, with about 300,000 vaccines available. But COVID has had an impact. The economic impact on people has sent them into the forests to get animals to eat or to cut down trees and other parts of the forest for their needs that they're not being able to get otherwise. And so it is bringing many plants and animals closer to extinction. For people, as we have repeatedly said, COVID has been very difficult economically, but nowhere more than the South. The South traditionally has issues with water and has had a drought, some type of drought going on for 40 years. But this year, it's just been exacerbated with climate change and also the economic effects where people can't find jobs that they normally would be able to find in times when COVID wasn't around. So more and more people, what are they saying, close to how many?
There's several 100,000 people who are now having acute malnutrition. They call it close to famine conditions.
So this is the worst that Madagascar has seen in a very, very long time. Into the midst of these difficulties is the FJKM Church, the Fionguna Jesu Christi Etu Madagascar, which feels very strongly that it needs to be both biblically based, sharing the good news of Jesus Christ, but at the same time, reaching out and meeting the needs of the people. It has a very holistic view of what it means to be a follower of Christ. The churches are full, or at least before COVID, they are packed. And as it is a young country, you would see scenes like this in most churches that you go to. It is a vibrant church with many branches like scouts, men of the church, women of the church, the evangelism department, the revival movement, to name a few. It also has over 700 elementary and secondary schools. And PCUSA is collaborating, walking alongside the FJKM in its efforts to give high standard education. And they're working with a program called Evidence-Based Methods of Instruction, or EBMI. There was a missionary before, Jan Heckler, who helped with this, and there is support continuing, and that program is continuing to help improve the education and the teaching that's offered by the FJKM school. The FJKM has many ministries, social ministries, but one of the big ones is to the marginalized people that is headed or led by Pastor Helival Poget in the center in this picture. Christy, who was mentioned earlier, a co-worker from who lives in the DR Congo, works alongside with Pastor Helival in some of these ministries to accompany her and assist her in those efforts. And Doug Tilton, who's the regional liaison for Southern Africa, and also one of the acting area coordinators, he has also worked with Pastor Helival in the areas of human trafficking. These are just a few of the types of ministries that the FJKM is involved in. Of course, COVID is now another thing that they are involved with because no one can escape it. It has brought hardship to the Malagasy people and to the church. And as Carol mentioned, oops, we skipped. Are we still there? Oh, as Carol mentioned, funds were raised. Can we go on? Funds were raised to assist the FJKM. Somehow one of the slides disappeared, but basically they've been able to use these funds to help retired pastors who didn't have pensions to, when the second COVID spike came this year, churches had to close down again. And if they had not had the support that had come from us, from the network and everybody who contributed, though the 330 people supported by the national office would have had to be on half salary. So they were able to maintain the evangelists and synod presidents and staff of the seminaries at full-time presence. They've also been able to supply their office with thermometers to be able to check about whether people have COVID coming in and out, temperature checks, and the cleaning supplies that are needed for the individual offices, as well as to give work personnel masks and protective equipment that they might need. They've offered some assistance to seminaries and orphanages where they had gaps, and also assisted in some southern Madagascar. Another thing that the FJKM has done in the midst of COVID is reach out with spiritual care. And so the chaplaincy, the shepherd movement have all been involved in small group services around the capital city and the country in the COVID tests and also in the hospitals. As we mentioned, the South has been a big problem. And in January, the FJKM produced its own PowerPoint to motivate members of the FJKM to be able to come alongside the church in the South and the people in greatest need. And so they were looking to both have short-term solutions, but also to look for long-term solutions. The Synod president down south, Center, Pastor Souza, and when he heard about the funds that were given by the Mission Network as a result of the request from the network, he just, his gratitude. He said that many people are flocking to the church now because they see that people care. And so they plan to use these funds for water, and if there's any money left over, seeds or food. My work is in public health and primary health care and prevention. And so at the beginning, I did a lot of work with training community health volunteers with the FJKM Development Department in their health program. The government has now become very involved in that. And so that program is sort of on hold as the development department figures out how to best accompany and assist the government in those programs. I work alongside Dr. Vwangi Rainaivuarison, who is the health coordinator for the FJKM health program. Another wonderful program that we have ministering to them, training to help them be equipped to face the challenges that they come across in their daily lives and the temptations and issues. We trained 40 youth peer educators, but because of COVID, we've not been able to get back and do follow-up training. But the hope is that this fall, we will be able to do so when school starts back. The FM has continued its desire to provide accessible and affordable quality care to the vulnerable people who don't have access. So many parts of the island do not have access to good health care. They're sprinkled in the red dots where the FJKM has dispensaries. One of these communities is Ankavandra, which is on the map in the red arrow. The dispensaries that the FJKM has are primary health care, so no CAT scans, no x-ray machines, but they're able to take care of the majority, probably 90% of the needs that the people face, like malaria, tuberculosis, or respiratory tract infections. Supervision is a critical part of assuring that quality care happens. Again, because of last year, they weren't able to do supervision until the end of the year. And this year, they were able to get out and start that earlier. Another important part of keeping quality care is through in-service training. In May of last year, we were supposed to do a that got put off, but finally it happened this past July. And this in-service training, they were able to look at emergency situations and how the doctor can take care of minor emergencies in their dispensaries, as well as talking about COVID and COVID-related issues. Probably the biggest excitement of those was receiving tablets that came as a gift from a grant from PCUSA. And these tablets, which you see them unpacking, to send reports electronically, both to the national FJKM office, but also to the government, and also to access medical information from the internet. These are just 3 midwives who serve at 3 of the FJKM dispensaries, and the arrows are on the island map. And all 3 of those have significant periods of the year where they do not have access to outside community because of the rain or how bad it gets. This is all the doctors together with their tablets. And one of the doctors shared that last year he actually had 2 patients die of COVID, but he did not have a way to get information to the government. And so he was so grateful to have the tablet, because that there's 3 main networks that have access to the island, that all the doctors have access to one of those, and it doesn't cost very much money to link on and send information or data. There are some critical health problems in Madagascar. Malagasy women, more Malagasy women from childbirth, about 10 a day, and it's one of the highest in the world related to complications to pregnancy and childbirth. Infant and child mortality remain high, related to preventable diseases like malaria, diarrhea, and malnutrition. The FJKM's dispensaries are committed to providing good health care through prenatal care. They planning services, safe deliveries for uncomplicated births, and also shots and vaccinations for the main illnesses that infants and children face. The reality with COVID now is what you see there. Every dispensary now has posters up and all hand sanitizer situations, and the doctors need lots of supplies to keep themselves protected and also to keep their dispensaries clean. They continue to provide care even when roads are shut down. The doctors and medical staff continue to wear their masks, but as you can see, many people in the remote areas are not following those protocols. There is an urgent need that the FJKM health program is requesting for raising $10,000 to help provide its 32 dispensaries with protective supplies for the next wave. They're okay now, but they anticipate low level of vaccination of the population, that there's likely to be another wave and more need for protective supplies. Increasing access to quality care and improving maternal child health are main commitments of the FJKM's health program. The AIDS Committee is still operating and working on preventing and treating HIV/AIDS. The FJKM has been very involved in this work since 2001, training in counseling and how to part of their work, and making sure that all of the students meet someone who's HIV positive. Madame Maya in the center in the yellow dress is HIV positive, and all the seminary students were able to meet and talk with her. Training continues, but now it's socially distant with masks on. Instead of having get-togethers where we eat, now we try to share food with the seminary because of the economic difficulty, and also because eating together without your mask on is not a good idea in the time of COVID. Getting HIV testing, providing HIV testing was an important part of what the FJKM's program did. But since last February, so almost a year, they have not been able to do that. But luckily, we're invited and able to take part in the General Assembly this year and provide HIV testing. So Pastor William Machacha, who is carrying the 2 briefcases, he is the head of the FJKM AIDS program, and Mr. Hadza Randriambulzonna is the accountant, and they were there as part of the team. We had a tent for HIV testing outside the compound of the church, and basically inside there would be partitions so that people have individual pre and post-test counseling. This is more of the AIDS staff. With the local staff jacket is Mr. Rene Ravau. Thank you. I'm tired and it's a tongue twister. And he is the national coordinator and a wonderful guy. This is the medical team setting up inside that tent. We also had people went out and distributed information and leaflets and brochures and invited people to come get tested. They were able to test about 350 people with 4 positives. We also had a little booth to share information when people came in, as well as to give them a free mask and keychain. These are just 2 of the young ladies who came to get. They are pictured with permission and wearing their new COVID masks. At this General Assembly, the FJKM decided that they wanted the FJKM AIDS program to help combat epidemics. And that's because the AIDS committee combines a member of each of the branches of the church. So it is one body where all of those would come together and could discuss how to attack and address an epidemic. So this will be something that we do going forward. We really appreciate all the assistance that so many of you are watching have given to the health program and the work of the health ministries of the church.
Whoa. I worked with the Fruits, Vegetables, and Environmental Education program of the FJKM. This is my main colleague, Roland Rosafiarson, who also was able to attend the Synode Les Baies meeting in Saint-Bave. And this is my colleague, Germain André Naivusson. He is a plant propagator and has propagated probably more kinds of fruit trees than anyone in the country, grafted, I mean. And here he is teaching seminary students how to graft. We teach a program in we have taught in all of the seminaries. In the time of COVID, we've been forced to concentrate at the Ivatu Seminary, where we teach gardening and fruit growing and some environmental education. This is the main garden on the seminary campus at Ivatu. All of the students and their spouses take part in the activities in the orchard and in the garden, and they eat the benefits from that garden. These are purple yams. And this really helps them get food during their time as students, but more importantly, it gives them skills that they take with them to their first churches, where they will, those skills will help their families and also be of assistance to people in their churches and communities. We're training for university students, especially students from the FJKM Ravel University. This is mostly in the form of internships, especially for the agronomy students. The first year students do an internship at Ivatu, the second year students at the Fruit Center that you'll hear about, and a few third year students come back and do special projects. The FEE has for many years been involved in planting trees at schools, some 700 schools Elizabeth mentioned, and these are mostly fruit trees and especially native trees. We also plant some at public schools. This is a shade tree in the front, and also just trees for beautifying the school grounds. But especially we plant these native trees for their value for environmental education, to help the students come to learn and to love the native biodiversity that is unique to Madagascar, and hopefully that will help them become good stewards of the special plants and animals in their country. And these are some of the trees and shrubs that the FEE propagates in their nurseries and that then get planted out at schools and also at churches. And some of these trees are particularly rare. This is the critically endangered Tahina palm, which came from northwestern Madagascar. The FEE does a little bit with and this is where they give assistance every year to the FJKM's annual tree planting day. And to a certain extent, we help other entities of the FJKM with their reforestation efforts. Whoa. And that is Roland giving Pastor Ruta advice on, I don't know why this is keep jumping, on how to transplant those eucalyptus seedlings near Umbalaval. But most of the work of the FAE is focused on fruit trees. And this is because fruits all over the country provide needed food and nutrition, but also they are a source of income. One of my colleagues in my early successes was in helping the town of Antananarivo to grow tangerines. And this started back in 2010. Fast forward, in 2017, the trees really started to produce good crops of tangerines, and in 2020, for the first time, trucks came from the capital city to buy tangerines by the truckload, and things have really taken off. And one of the growers at Antananarivo said that he gets more money for his efforts growing tangerines than he does growing rice or raising cattle. So I feel that the people in that town have really gotten on a path out of poverty by growing tangerines. But early on, we recognized that the shortcoming of tangerines is that they require irrigation. And this is in the form, at Antananarivo, is in the form of water from a spring uphill from the village, and the water can be brought down through hand dugouts to get water to the trees. Unfortunately, it's not everywhere where this can be done. So the potential of tangerines, while great, is limited to only certain places that can do the irrigation. So we started looking out to see types of fruit trees have potential to be of assistance to more people in the country. And we recognize that what we think is the fruit with the greatest potential to help the most people is the mango. And that is because mangoes grow in a climate where there's a really long dry season, and they grow on soils with fairly low fertility. And that describes the situation in northern Madagascar, western Madagascar, and most of southern Madagascar, except the very far south where there's not enough rain. So to help achieve the potential of mangoes in Madagascar to help people get out of poverty, the FEE helped the FJKM set up a fruit center at Madzinzu, about 4 hours by road northwest of the capital city. And the big event right before COVID arrived in March of 2020 was the inauguration of the Fruit Center. And the attendance at that event by pretty much all of the high leadership of the FJKM, led by Pastor Ami cutting the ribbon, was just sort of symbolic of the priority that the FJKM puts on helping people in general to improve their lives, and in particular on the efforts of the FEE program. The FEE planted the first mango trees in January of 2017, and now those trees are 4.5 years old. And even though right now we're in the middle of the dry season in much of Madagascar, those trees are nice and green and growing well. Indeed, this past December and January, for over 20 different varieties of mangoes produced fruits. And some of these varieties are some that you buy in the grocery store, like Tommy Atkins and Kent, and others are some of the ones widely appreciated in different parts of the world, like Kensington in Australia and Malika and Alfonso in India. And many of these varieties were brought to Madagascar from Florida by the FJKM, following all proper procedures with help from PCUSA. At the nursery at the Fruit Center, the technicians are busy grafting mangoes. They do that using the approach graft, which is a graft widely practiced in India. They also cleft grafts, which is a good graft for mango. And when we mangoes, as important as the grafting itself is the writing of the labels to make sure we keep track of the varieties. Now you might ask, why graft mango trees and other fruit trees when you know that they can grow perfectly well from seed? And part of that answer is in that picture. People are always asking when they get a grafted tree, how soon will I get? Well, actually, a grafted tree can produce fruits very quickly, sometimes even before you plant the tree. We don't advise that because that fruit will sort of suck the energy out of that growing tree. So I try to get them all cut off from the small trees. You want a tree that maybe has a diameter of about 1 meter or so of its leaf area. But mangoes, they produce fruits earlier than seedling trees. Mango trees that are grafted are also shorter and squatter, which means that it's easier to produce the fruit and fewer fruits get lost from bruising. And a third very important reason is that if good varieties are selected or identified, then a farmer can grow via grafting. The farmer can grow a whole herd of a single really good variety and get experienced with that variety. This is the Kensington variety from Australia, and that's one of the good varieties. So right now at the Fruit Center, we have over 1,200 grafted mango trees, and we also have about 5,000 mango rootstocks that will be ready to graft this December. So with these grafted trees, well, they feed into a program of extension work. So this is how we are going to we are working with farmers to help them realize the potential of mangoes, grafted mangoes, to improve their lives. So right now, with help from the Presbyterian Hunger Program, we are training farmers in two categories. The first category is what we call pilot farmers. And this is where we train farmers to grow mango trees so they can grow and then propagate so they can have as many trees as they would like. The second category is what we call volunteer technicians. So we train pastors and then also usually a lay person who's a volunteer technician from the pastor's parish who agrees to volunteer to help the church in their tree growing activities. And in exchange for volunteering with the church, the FVEE is helping those people to be able to set up their own tree nurseries. And so when all of these trainees, when they finish their training, they get grafted trees to help and plant. And they also get pots so that they can propagate trees, and they get a grafting knife and a sharpening stone so that they can do their own grafting. And this volunteer technician, Romain Ranjamanana, with his little nursery at Matsinzu, he's the volunteer technician at Matsinzu, and he is already marcotting lychee trees and grafting mango trees to plant himself. Other participants in these trainings have planted their trees, and when we've gone to look, we found that most of these trees are alive and growing well, and that their owners are very excited about the potential of their trees and looking forward to getting fruits from them. Another major activity of the FVE in the last couple of years is setting up new fruit nurseries in different parts of the island to serve, that will be managed by different entities of the FJKM. This particular nursery was set up at Fionana, about 50 kilometers north of the capital, Antananarivo, set up in about 2 months, October and November of 2020. And this is on of a new agricultural house that the FJKM is setting up. So this map shows the locations of a lot of the work of the FVEE, particularly the program and the tree nurseries. At the bottom down there is Betruca, which marks our effort to extend our work into southern Madagascar. It's got a question mark because we're currently investigating the exact church, but we are planning on doing training there in 2022. Likewise, in the far north at Antsiranana, there is a question mark really for a nursery. Right now, my colleagues, Roland and Germain, are three locations on the map, starting with Ankaramena in the south. The Ankaramena FJKM Church is right on National Road number 7, which is the main artery to southern Madagascar. I call this location the gateway to southern Madagascar. They say in business that location is everything, and this church has an excellent location to be able to provide grafted mango trees and other fruit trees for people traveling to southern Madagascar. One of the first big steps we did to setting up a nursery at this site was to put a wall around the church property. And the reason for a wall is to keep the cattle out and to provide security. We also have already done some initial trainings, initially to train church members in how to grow and graft fruit trees. And so a number of these trees are already growing on the private property of the different church members. And those ones that are in yellow pots are being saved to be planted on the church grounds as soon as the gate is installed to close out that wall. So this nursery should be finished at the end of the year. Already a nursery manager has been designated by the church, and we have finished that nursery manager's initial training, and he is on site working away and giving advice to his neighbors and helping to care for trees at the church. Now let's go up to Mandritsara in northern Madagascar, where the FJKM has one of its seminary. This is the northernmost seminary. And the FEE has been doing training for pastoral students at the seminary for a number of years. This past October, Roland took up the mother trees to serve as sources of grafting material for the nursery. And these are seminary students who are potting up those newly arrived trees in those big yellow pots to let them grow bigger. And in October, Roland also brought Jeremiah Rasiraunana, the nursery manager, who had been at Ivatu Seminary and at the Fruit Center getting trained for many months. He brought him up to begin nursery work. And Jeremiah found at first there wasn't really anything there. There was a well and a pile of bricks to build his house, as you see in the top picture. But by May of this year, his house is finished and he's moved in, and the mother trees are there around the house. And he didn't waste time, but he has already produced hundreds of mango rootstocks and has begun grafting trees. And as soon as my colleagues Roland and Germain finish their training at Antsiranana, they are heading to Mandritsara to do training next week for pastors and for volunteer technicians from the synod where the seminary there is located. And now let's go down to Sarahunenana, which is a village about 50 kilometers north of the Fruit Center, but it's at about 200 meters lower elevation than the Fruit Center, better climate even for growing mangoes. And so this past March, my colleagues did a training for 50 adults from Sarahunenana and one baby. And the people at that training really appreciated the training. Mrs. Agnes Rasuari Mirina said, I received a lot of benefit from the training because I did the graphs. My hands made the graphs. But before, when I did training, the technician did it and said, that is how it is done. But here it was me who did it. So the participants really appreciated the hands-on approach to training that my colleagues did. And it actually, in this case, it was on the 1st of April that Germain Andre Nausson was able to deliver the trees to the trainees at Sarahunenana. And you see there in the back, Pastor Modest Rasulabamkianana in the maroon shirt. He is the pastor from this area, and also in the back row is the volunteer technician, and they will be providing technical oversight. My colleagues will, and I look forward to going there myself to provide the encouragement and the technical assistance that these people will need to realize the potential of mangoes as much and as far as they want to take it, because they have, you see the national road right next to them. They have tremendous potential to sell their mangoes to trucks coming by. So if all goes as planned for them and for us, then we feel that that will help the people of this village get on a path out of poverty by growing mangoes, much as the people of Antaneti Bay have gotten on a path out of poverty by growing tangerines. This is the exhibit that Roland Razafarson had on display at the Synode Les Baies meeting at Sambav this past week. And that was a tremendous opportunity for Roland to interact with pastors and lay people from all over the island. In the meeting itself, the Synode Les Baies affirmed the FVEE as one of the programs that is a benefit to the church in many ways and has asked the MFEE to expand their activities as much as possible. And Roland received a number of requests, and one of those was from the Synod President from Northern Madagascar. And so we're pleased to be able to respond to his request right away by providing training immediately after that Synod Lebe meeting. So there are a lot of people who are smiling about the potential for Mangos to really bring change in their lives and a path out of poverty. My colleagues and I and all those who've gotten training are really excited about this program, and we look forward to seeing where it takes many, many people.
Thank you so much for supporting us and the ministries of the FJKM in Madagascar. An important part of that is prayer. We would just ask that you continue to pray for the elected leaders, for the FJKM in Madagascar as they deal with the COVID crisis, and for those who are hungry, especially in the South, that there would be short-term and long-term solutions.
Please also take the opportunity to take part in the Madagascar Mission Network. This is a very dedicated group of people who work hard together to promote the partnership with the FJKM in Madagascar, and the more the merrier. So we hope that all of you who are with us here tonight will want to take part in this group and share in the fun that we all have, partly just being together, but especially in knowing that this is contributing to the partnership with the FJKM and to helping the people of Madagascar.
You could pick a project. Maybe you got excited about hearing about a nursery or a training, or you'd like to help the FJKM dispensaries get some protective supplies for their dispensaries. Something that a Sunday school class could do, or a church. That's a wonderful way to continue to help the FJKM as they reach out to the people around them.
Please also continue to support us as mission co-workers and also the other co-workers who are involved in Madagascar. That's Christy Boyd, who's with us tonight, and also Doug Tilton, who's our regional liaison out of South Africa. And we're very grateful for all the support that all of you have provided for us over the years.
We really couldn't do what we do without your prayers and support. And the FJKM really appreciates that. It makes them feel that they are not alone because they face many, many difficulties. And sometimes you feel like you're all by yourself, but they have said repeatedly to us when they hear of churches and individuals that are praying for them and supporting them, that gives them the courage and the inspiration to keep on going, that they've not been forgotten. Thank you so much for what you have done and are doing to help us and the FJKM make a difference in the lives of the people of Madagascar so that their futures will be brighter. As they say in Malagasy,
Misota Betsaga Tumko.
thank you very much.